Welcome back to Talk 1260 KTRC. This is the Humanity Behind the Vanity. Dr. Daniel Rennell here with my wife Betsy. And we just heard a nutritional tip by Mark Wood, our dear Mark Wood, who's passed away.
We're going to use those over and over again. We miss them so much.
Yeah.
Anyway, all right.
And what do you want to talk about now?
I don't know, resort season is here in the fashion world, so I'm sure that correlates to something in plastic surgery.
Yes.
What do you think?
I think the winter is deeply upon us and everybody's thinking about it ending.
Yeah.
And what do we think about is bathing suit season coming up. So,
yeehaw!
Yeah.
I'm kidding. Okay.
well, we're doing a lot of tummy tucks these days in our office. So I wanted to talk about sort of the modern abdominoplasty, the modern tummy tuck. It's really all about, in this day and age, getting back to work quickly, having a quick recovery time, having results that last, and one of the big issues with that is pain control. So we've talked about the iFlow, the pain buster, many times on the show. And just to tell you again, this is a little, and for those watching on YouTube, I'm holding up my hands. It's a little balloon.
The size of a tennis ball.
Or a grapefruit.
Okay.
Yeah, full of anesthetic medicine, and you wear this balloon on a fanny pack, and the balloon contracts by itself, and it shoots in pain medicine through tiny little tubes right into the site of surgery. And studies show that people taking people on this pain buster take fewer narcotics. Now, I still give out narcotics because it still hurts, but there's much less of a need for them with the pain buster. So that's one thing. The other thing is that modern techniques of tummy tucks are a little less invasive and a little less barbaric. This is just like the facelift that I've talked about. And Alan Matarazzo, who's a really famous plastic surgeon in New York, sort of described the modern pattern of doing the tummy tuck from the inside. It used to be that we lifted up the abdominal skin all the way to the edges of the abdomen and all the way up to the ribs so that we could pull it down tightly. And now the modern abdominoplasty is really done with much less dissection. There's less trauma inside under the skin, so less trauma, less swelling, less bruising, less pain, easier recovery.
What do you do?
Because instead of a big square dissection underneath the skin, it's more like a triangle, more like a Christmas tree. And so we preserve a lot of the blood vessels and nerves in there. Now, having said that, excuse me, a lot of people have numbness after an abdominoplasty for a few weeks, sometimes for a few months, and that's totally normal.
Yeah. Who cares?
It's totally
Get
normal.
over it.
Right. Some people find it odd, and so that's okay. So that's one thing. Also, drains are important to put in. And people have always had drains for a long time. Sort of the modern, and drains traditionally have prevented people from taking showers, and they just feel really gross. After a few days, though, the skin has started to heal around the drain, and it's okay to take a quick shower, even with the drain in, and to dry the drain site with a hair dryer on cool. And then lastly, integrating other fields of medicine into the traditional Western medicine is really important because it takes healing up to a new level. Preoperative acupuncture, and even some sort of holistic medical aesthetics with dermabrasion, reflexology, all these things, taking arnica, all these things help decrease bruising and swelling and make it an easier thing from which to recover.
Yeah. Sounds good.
Sounds good, okay.
I haven't had a tummy tuck yet. I'm not done having children. I choose not to have a tummy tuck until I'm done having children.
Right.
But I've had 2 C-sections, and I know the first 2 days are quite difficult to walk. Is that the same with a modern tummy tuck?
I think it's difficult to get out of bed for the first day or two, although you really have to, and we encourage walking just so you don't get a blood clot. The difference between a C-section, though, is that a C-section cuts through the muscle, and it also cuts into the internal part of the abdomen where all the intestines are and the uterus is. But a tummy tuck does not cut any muscles. It does move
See,
them.
I didn't know this. You've said this so many times,
Right.
and yet I cannot get that through my head. That's major.
Yeah, that's really nice.
That's
it moves,
the pain of the
right.
C-section.
It moves
Okay.
them together. You sew them together because often people who need a tummy tuck have had children or
Right.
have packed on a lot of pounds, and so those two. And for those watching on YouTube, those two rectus muscles are splayed out.
Those
So
are the two muscles around your belly button.
right, and so the tummy tuck sews them back together. And actually, I also like to sometimes sew the external oblique muscles,
Yeah,
the muscles,
baby.
right, and you
Yeah.
can narrow the waist that way.
Yeah, I
Um,
love it. I love it.
But there's no cutting of the muscle, which is
See, that's why can I
which is
not
nice.
just drill that into my big head?
That's okay.
That's huge because I think that's really where the serious pain
Pain
in
is.
walking
Sure.
comes from.
Sure.
Is in a C-section anyway, is a cut into your muscle.
Yeah.
Or anyone who's had abdominal surgery, it's the cut into the
Yeah.
muscle.
Yeah.
So this must be I'll try one day.
Okay. No, it's kind of like that's why I like doing breast augmentations through an armpit incision.
That's what you've done to me. Ain't
Because-
nothing.
Because you
Yeah.
don't cut the muscle when you do a breast
Yeah.
augmentation through the traditional approach under the breast,
Yeah.
which I still do because many people need that. You have to cut through the muscle to get the implant under the muscle. But when you go through the armpit, you slide it under the muscle. There's no incision in the muscle, and it hurts less that way.
I was picking up my then 18-month-old, a day later.
Right.
Against doctor's orders, but still I could do it. I had no problems.
Yeah. Yeah.
And I had the pain pumps, iFlow. So yeah, I love these modern techniques, doctor.
Sure, it's important. There are even more modern techniques. There's a group in Brazil that is talking about, instead of undermining with a knife and an electric scalpel, which is what I do, undermining means going under the skin and lifting it up, they're doing it just with liposuction. Now that's very interesting to me because a lot of the bleeding and swelling and all this and eventually the pain comes from the necessary cutting that you do, of the fat underneath the skin. And if they're doing it with liposuction, then that's very interesting to me. So these are reports that have come out in the past year, and I'm waiting to see if the results last and if they're reduplicated in American
Nice.
studies. But it's important to know that there's even better things out there.
Oh, everything's getting better and better.
Yeah.
Certain things.
Yeah.
I wish the economy would, but yeah,
Yeah.
everything else getting better and better
Okay.
over time. All right.
Well, we're going to wrap this up. Thanks for listening.
Thank you for listening, and please do call the Santa Fe Botanical Garden. I do not remember the number. Linda Milbourne, and just truly, again, no dollar is too small. No dollar amount is too small. Please, whatever you can donate to this wonderful memorial, please do so. And if, say, you don't want to give an actual dollar amount, but you'd rather give a plant that you personally knew was one of his favorites, perhaps ask about that. That would be very, very touching.
Sure.
And I bet you they'd be open to that too.
And we're also having another Vanity for Charity
yeah.
month in March. In the month of March, all the profits from Botox and fillers are going to go to a small local nonprofit school in Santa Fe.
It's
So-
funded completely on grants and the tiny amount of tuition that they charge people.
And to get
So,
people in the door, I'm going to discount all that stuff 20%,
that's big.
and all the
Yeah.
profits are going to go to
Right to
this
the
school. So that's
And
in the month of March.
We're not allowed to say the school's name because the school doesn't want to advertise itself in this way. That's the only reason we have to be so
Right.
clandestine about it.
Right. Okay, thanks very much. We'll see you next week, 12:30, our new time,
Right on.
on Talk 1260 KTRC.